Today in our Health Spotlight, we're talking women's health, specifically menopause. And it's a hot topic on the minds of many women. And joining us today, we have OBGYN Dr. Alyse Kelly-Jones to walk us through what you need to know. Thanks for joining us.
Thank you for having me.
So, big topic here. Many women, they don't even want to say this word out loud. It's a scary topic for them, but let's talk about it today so they don't have to. What is menopause?
So the definition is the stopping of your menstrual cycle for one entire year. So if you go 11 months and you have a little bit of spotting, then you get to start counting over.
Okay, so it has to be a full year.
Correct.
So why is menopause such a big topic for women right now?
So I think it's become a big topic because there's a lot of social media out there about it now, where for 2 decades there weren't. And for 2 decades, because of certain studies, we told women hormones were bad. They cause breast cancer, they cause heart attacks, they cause stroke. Don't take them, do something different. And we've now since found that maybe some of that information wasn't so true, but there's been a lot of information out there that's really pro-positive, pro-menopause, and getting yourself treated.
Well, you mentioned that it's a full year, but what are some of the other symptoms that women can pay attention to know that they may be going through this?
Right, so it actually starts before that full year because it starts in perimenopause. Peri means around, and that's a period of 7 to 10 years where your ovaries decide they're not going to work anymore. But they're sneaky. They work for a little bit, and then they stop. And then they overwork. So it's kind of a roller coaster ride. And the sign that a woman's perimenopause is her menstrual cycle changes. And that's when she may begin to have symptoms.
Well, for some women, they may have had a hysterectomy, they may have an IUD in place, so it can be kind of hard. Yeah, how do you know if you're not having that cycle? So what symptoms can they pay attention to?
So for somebody like that, she may have difficulty sleeping. She may have night sweats. She may have mood issues. She may notice her mood gets like crazy sometimes and then she's fine sometimes. She may actually start to have some hot flashes, but I see night sweats way before I see hot flashes in my patients.
And if they are having these and, you know, they're realizing they're going through menopause, how do they treat it?
Well, it's really simple to treat. We replace your hormones. In a patient with an IUD or hysterectomy, I might get some blood tests to figure out where her hormone levels are, and then I'm going to treat based on her symptoms, but also based on where her hormone levels are.
And some women may not be able to use hormones, though, because there are some cases, like if they have breast cancer, that's the most common one. So what's their plan of treatment?
So never before have we had more options for women. So we actually have a few FDA-approved products that are not hormonal that a breast cancer patient would use specifically to treat hot flashes and night sweats, and then that may help her with sleep. So they have options too, which is a really good thing.
So great. Well, where can our viewers go if they want more information, or maybe they need to come in and see you and get some treatment?
Right, so I'm with Tryon Women's Center, and we have 10 providers that see only GYN. We don't do any obstetrics anymore. So they can see any one of us. We're all have been kind of schooled in everything to know about menopause and perimenopause.
Great. Thank you so much for joining us today.
You're welcome. Thank you.